out there that I want you to take a look at. Government has always grossly underestimated the cost of the programs that it puts into place. And this is healthcare costs. Historical understatements highlight the unreliability of projected costs. Medicare was passed in 1965, and Congress estimated that Medicare would cost $9 billion in 1990. It actually cost $65 billion. And with all of the changes in Medicare, the ratios of government underestimating the costs are about 7 to 1. So we have a historical analysis where government has time, they've never overestimated the costs, they've always grossly underestimated the cost. There was a study that was done in the late 1980s, and it showed, for instance, with Social Security, the kids that were born in 1987, who are today about 22 years old, those kids, when they get into their prime earning years, could be looking at about 25% of their paycheck going to pay just for Social Security. Medicare costs a lot more than Social Security, so that would be at least 50% of their paycheck. That doesn't include federal income tax. If you include federal income tax of about 30%, now that 22-year-old is up to 80% tax rate. Then you have to include your state taxes. In Minnesota, maybe that's 8%. That'd be 88%. That doesn't include property taxes, sales taxes, gas taxes. We cannot do that to the generation that's coming up, to spend money without thinking about how it's going to be paid for. So I lay that context down as we talk about the future of healthcare, what we're going to have and what we're going to pay for it. One option is to have the government take it over and pay for healthcare and create a new program. Here's another option that hasn't been talked about very much. And that's the option where you own your healthcare, not government, not a business. That I think that we should put into the debate mix to talk about. Because this is something that won't add to the government debt substantially the way that the option does on H.R. 3200 in the House. If people can own their own health care, here's a couple of things we can do. And we can go forward again and talk about this further because, again, we want to get to your question. We can do this. There's a law right now at the federal level that says that states can, in effect, draw boundaries around their state, and insurance companies don't have to compete with other companies outside of their state. This jacks the cost of healthcare way higher than what it would need to be. If we took a big eraser and erased those lines at each state boundary and allowed people to buy healthcare anywhere in the United States, in other words, if we allowed more competition among insurance companies rather than less competition, we would see more insurance products at cheaper prices and people could buy what they want. The level of health insurance. Something else we can do that currently isn't being done, we can allow for associated health care plans. Where let's say realtors, for instance, who are in essence are self-employed, realtors could all band together like a credit union does, and they could pool together and use that purchasing power to purchase a health insurance policy and again bring the cost down for their members. If they want a high deductible, then we can offer people tax-free savings accounts. So if you have a high deductible, let's say, you'd have a tax-free account, you put your own money in that account, you can draw your own money out, you can pay for your high deductible, but also you can pay your co-pays. You can pay going to the dentist. You can pay going to the eye doctor, getting a hearing aid. In other words, giving you the power. Think of it as like a backpack that you would put on. And it's your health care, and you make the decision about how much you want. Not some bureaucrat. You make the decision about how much you want. The very first bill that I introduced when I went to Congress was the Health Care Freedom of Choice Act. This idea has been around a Garrett Stager, because what we want to do is level the playing field in the tax code. We want people to be able to have the same advantage to buy their own health insurance that businesses have. Businesses can fully deduct the cost of health care, but individuals can't. I believe you should have the right to fully deduct your health insurance premiums, your co-pays, your deductible, whether you go to the dentist or the eye doctor or get a hearing aid, you should be able to deduct that on your income tax. And I think we can make healthcare affordable for the vast bulk of people. Not everyone will ever be able to buy healthcare. There will always be a cohort of people, through no fault of their own, who just can't. They're profoundly disabled. They have extraordinary medical conditions. We are a compassionate society. We will always have that safety net. We have to for people who need that. But let's not destroy what truly is the greatest healthcare system the world has ever known. So thank you for being here. I have so much more I'd like to say, but I will hand this over to Dr. Mike Burgess, and I want you to know, Dr. Burgess has been a member of Congress since 2003. He's been a great fighter, and he's been bringing together Republicans and Democrats on true health care debate and reform. He's a great bipartisan leader, and best of all, Dr. Burgess was born in Minnesota at the Mayo Clinic where his father was a physician. We're just trying to figure out why he ever left. But he's a representative of Congress representing the Dallas-Fort Worth area from Texas's 26th district. Please give him a warm welcome.